Hello, everyone, and welcome back to your own channel. And we have our own Dr. James Lozier, and I am Dr. Jasmine. And we are back with an amazing doctor, Dr. Kesha Patel. Our today's guest is an aspiring dentist, just like me, who came to the US and is wanting to go to dental school. We all know our own Dr. James Lozier, who is our father of dental decks. We met him in our last video, and he is amazing. He has helped so many dental students, including me. So, yes, he is my godfather too. Although at that time, when I was studying dental decks, I did not know that one day I will be meeting him. And so I am going to have Dr. James Lozier, who we all know as either Dr. Lozier or Dr. Jim, like I love calling him. And he would introduce himself again to our new audience.
Hello, everyone. I am Dr. James Lozier. I founded Dental Decks back in like 1990 when I got out of dental school in 1988 and developed the part one and the part two for everybody to help them pass their national boards. And I did that for 20, 25 years almost. And then when the word got out that they wanted to start doing a new exam, the integrated national board exam, just to throw a monkey wrench at the dental students, I came up with the new product, and it's called Digital Dental Notes. It's a program, it's a software program, all digital. It composes both parts of the exam because now it's case-based as well. It's 40% is case-based and 60% is in the format of the old national boards. So what we did, me and my team, developed the digital dental notes based on 154 cases. It has over 1,000 case-based questions and also over 2,000, we call them standalone questions. They're not based on a case. They're based on a subject, be it oral surgery, oral pathology, anatomy, physiology, biochem, everything. And we also, what I came up with, I call it an e-library, which I really, really like. It's a library that composes notes about every subject matter that is tested on the exam, be it anatomy, biochem, physio. And you can actually, when you're answering a question, and you can click on a word, say the pancreas, and it'll link you to the e-library. So wow. It saves you time. Like if you want a review, all the questions have answers on the back, just like the old dental decks did.
Nice.
But now I'm not limited by a flashcard. You know, the back of the card, you do flip it on the digital program, but you flip it over and it has the explanation. But if you want more context, it's been a long time since some students have had anatomy. So you can click on and open up the anatomy section and it'll review the heart, whatever, blood vessels, cardiovascular system, skeletal system, the whole, everything. It's over 1,750 pages of concise notes done by experts in their field. Nice. I have an oral pathologist, an orthodontist, an oral radiologist, a prosthodontist, periodontist, oral surgeon to cover all the areas. And that's really been amazing. The student feedback on that has been really good. It gives you more context. If you want more, you can have more. If you don't want more, you move on in the program. And the one thing I really like about it, as opposed to the old dental decks, the new digital dental notes, is that it's a whole program. And you get out of it whatever you would like to get out of it. It keeps track of your scores. It keeps track of how much time you're spending. You go back in wherever you left off. You can make notes. You can go back to a certain card. You can check a card. So there's so many things, and it's great being digital that you can do that now. I didn't have that back 30 years ago. And I'm really proud of it. And I think it's going to really help people take the fear out of facing this exam.
Thank you so much, Dr. Jim. I agree with you because um, when I studied for my boards, I had the dental decks, the standard dental decks. And I know to go somewhere, you always had to carry them in your backpack. So I think this is amazing, especially with the new app generation.
Yeah.
And I know that's I'm kind of dating myself saying that I belong to way a few generations back than this generation that's prepping for the exam. But I think that's fantastic, especially the fact that it's so portable.
Yes. Yep.
Love it, love it, love it. So let's go to our newest guest, Dr. Kesha Patel. Dr. Patel, tell us a little bit about you. Tell us how did you meet Dr. Jim, and tell us your journey about the new dental decks.
Hi everyone, I'm myself Dr. Kesha Patel, and I graduated in 2015 from Rajasthan University, India, and I came in here in 2020, and I was working as a dental assistant, yet I'm still working as a dental assistant, and it was just my God gift that I just met Dr. Lozier, and I just cannot like say anything about that. It was just God gift, and he introduced himself with the digital dental notes, and it was amazing. And I had my dental like oldest standard version with me, and I always used to carry with me because one of my friend who passed this exam, she suggested me that, you know what, the dental dex is very good platform to get this in exam. So I was using that, but Dr. Luzier gave me the best, and he gave me his app and all website and password and everything, and he helped me with each and every topic and everything. Even he was emailing me that, could you able to log in, could you able to see my notes, could you able to just look it into once. And he helped me, and he put like much effort to get into it, and I really appreciated him for that. And once I started that, then I realized that it was so detailed and explained information in that, and I really like it about that. And it was like, I can say there are specific portion of that as he was saying just now, that the library, it was the most useful thing. And even I have revised that library, whole library, 2 days ago before my exam.
Oh, wow.
It was really helpful. Like, the library include all charts in there, the little paragraphs, the oral pathologists, all like photos, images, specific wordings that we can remember. Oh, this is ameloblastoma, and this is like planus and everything. So
Nice.
it was all detailed explained, and what we needed like before the exam. It was so detailed.
Wow, wow. So you are working as an assistant with Dr. Jim.
Yeah.
Fantastic, fantastic. And Dr. Patel, you did take both, like you took the inbde, right?
Yeah, inbde. Yeah.
Fantastic, fantastic. And since you did mention, and I know Dr. Jim also did, that there's essentially a library that you can use. So unlike when we are reading a textbook, how we are putting
Yeah.
those little markers and then you have to go back to the markers.
Yeah.
Can you tell us a little bit more, like what was different with this, like, and how easy is the fact that this app is, or, using it on your computer, the portability, like, did you like it? And
Thing that I can carry all over wherever I'm going. That's the bestest thing. Because the standard things that I have at like as a dental flashcards, I needed to carry with wherever I'm going. But this thing that even if I'm working, still I can, go through like 1-2 questions if I get 5 minutes. And then I just go back to work. And whenever again I'm getting 2 minutes, and I can again do 2-3 questions. At that way, even I was able to do at least 50-70 questions while I was working. So like, even like specific giving time to studying, still I was able to do that question. So it was really helpful, just because this digital dental notes. because it's not possible every time that we carry our flashcards and we put everywhere at workplace, you know.
Nice.
But the digital things are, you just logged it every time and you just go through it whenever you get time. So it's so useful to me. And I'm really appreciated for that to Dr. Lozier. I really appreciate it for that. And he always, and we always meet like once in a week, and he always asks me how you doing and how you up to there, how's your preparation going. He always motivated me about this. So, you know, while you're doing any kind of preparation, you need motivation, like from somebody
Yes.
that, oh, you can do it, you can do it. So that's the thing that helped you a lot.
That
Yes.
is fantastic. Yes, I think one thing which even I noticed, and I actually met Dr. Jim at a convention accidentally in Philadelphia. And, the first thing I noticed about him is he's a very selfless
I
giver.
know.
He
Yeah,
really
I agree.
wants people to succeed in life, and he wants to be. I think he just loves to be a part of everybody's success, which is,
Exactly. Yeah, I
I
agree.
was, and I think I do want to share it with our viewers. This is something very interesting. On one of the videos that Dr. Jim and I did, one of his classmates actually commented saying that, do you remember our school days and how we used to, work in the lab together? And the fact that he has been so helpful and such an amazing person, since
Yeah,
dental school. I think, um, Dr. Jim, nothing has changed. I think from what the testimony that your
same.
classmate gave, the testimony that I have, the testimony that Dr. Patel
Mine
has
too
for you.
have.
I think we are very overwhelmed, and we are very, very, very thankful that we are a part of your community, and that you are a part of our dental community.
Yeah.
I'm proud and humbled by it, to be honest with you. I'm gonna blush. But I really, that means more to me than anything. Is just to be able to help, and to help people, help, you know this whole journey. I didn't realize, and I was telling Dr. Patel this, the journey for the international student is very different than the US student. And I can't imagine, doing that. And I give you, Dr. Jasmine and Dr. Patel, so much credit for just pursuing that dream and what you had to do to pursue that dream, to come to another country, really, leave everything and then try to get into, these schools. And it's so competitive, like in the US, it was hard enough to get, just the regular thing, but to deal with everything you guys had to deal with is amazing. And the fact that I can be a small part of that to help them attain their dream that's all I need. That makes me feel great.
No, thank you, Dr. Jim. I think your small part, which you feel is actually priceless and a very big part of the journey, because, taking the board, and especially, well, I can say a lot of years ago, when I came to this country more than about almost close to 2 decades ago, it was just finding someone who had taken the boards and asking them, what did you use for prep? And then some people would say, you know what, read the entire textbook. And then you were not sure, like, are you going to read like everything that you've read
Everything.
for 4 years, right, Dr.
Right.
Patel?
Yeah.
And then especially because I took a long break before, coming back to clinical dentistry. And like you said, Dr. Jim, that was a very powerful statement that you said. A lot of us are coming back to, we've been there in the clinical dentistry field, but whatever was taught to us in the first and the second year, it's there in our mind, but not as fresh as it would be for someone who's just graduating. And
Sure.
when you're taking the boards, everybody is, although on the same platform, but they are not on the same platform. Some people are great clinically because they've been practicing for 10, 15 years.
Yeah.
And some have just graduated from dental school, so they
Good
are
at books.
amazing theoretically. But I
Right.
think your decks are definitely helping bridge that gap and helping students, I would say, on both the sides to study, the ones who have very strong theoretical knowledge, they get the clinical aspect from, your decks. The ones that have a strong clinical aspect get the theoretical part, especially I think the biggest thing which people are scared of is pharmacology.
Right.
And
Different drugs, different medication name.
exactly. And, the fact that you have a panel of specialists who actually helped create these decks says that, so basically, with your uh, one decks, we are getting all the experts teach us through that one platform. And I think that is very powerful. And Dr. Patel actually said something which I think a lot of dentists would love to hear this. I'm going to say it again, that Dr. Patel did mention that when she had time in between patients, or when she's just sitting and sipping a coffee, or she's on the train, she can just use your decks because now they are more portable and she can bookmark them and go back to that. So, and I think that is super helpful, especially the fact because some people are great with certain subjects and need a little more attention and hard work on certain subjects, and then some people may need. And I think the fact that you can bookmark them and keep going back.
Yeah.
So
That's the thing.
Yeah, it's literally Dr. Jim brought, he's helping the social media generation to whatever makes them study. So, Dr. Patel, tell us a little bit more about, your inbde journey. Like, what else did you use to study? And then how exactly was, your exam? Like, how many hours? How did you prepare? A little snapshot. So I'm sure there are a lot of curious people who would love to know what they should do to reach the milestone that you have.
So, well, I came in here in 2020. So I started my preparation like after 2, 3 months once I get in here. And as my friend introduced that this is a dental dex, this is a standard platform to just pass this inbde exam. So I started my journey since then. And as I can talk about the inbde exam, there are 2 parts in that. So day 1, it's 8 hours exam, and day 2, it's a 6.5 hour exam, I can say. And we get like 100 question set.
Nice.
So first day we get 350 questions, and next day it's 140 question, and all are case based. And day first is like around 150 to 200 questions are like standalone questions, like it's a direct straight answer, you can choose it. And like other than that, they are all case based. And all it's not like that one prosto portion is going to come one subject, so or first to 50 question is going to be prosto. It's not like, it's the mix, so it's come everywhere. But it was doable. And I studied bootcamp too, mental dental videos, and Dr. James' best thing, digital dental notes that I always used to carry with me. So, like, my suggestion would be you should use at least 1 or 2 platforms so that you can get at least different question material, because you never get the same questions in the exams, but at least you should have practiced like 1 or 2 platforms, so that at that way you can connect your knowledge and bring it together and put as an answer best choice. So that's my suggestion to everyone, whoever is taking or preparing their exams.
Nice. So the good thing, Dr. Patel, that you just mentioned, and I'm going to just reiterate it, is that yes, people should definitely use a few platforms, because that helps you, because there are certain things which you may understand more on a video, and then there are certain things which you actually have to read it so your brain remembers them more, and it has to be a mix of visual, certain things moving.
I mean, it's build your confidence level,
Exactly.
Because if I'm using the digital dental notes and I got my question answer wrong, And if I'm using same, like another time I'm using different material and they are asking me the same thing but in a different way, and I would have able to do the same correct answer, so I would be happy. Oh, I got it wrong at that time, but now I can do it. So at that way you can connect it and you can bring it all together.
Makes sense. Yeah,
Yeah.
I feel especially, with the mandibular movements, I
Yeah.
am someone who had to see videos because, if you don't see it,
Yeah.
it's there in your head, you understand it, but when you actually see it moving, you're like, the animated videos help.
Yeah. Exactly. Yeah.
So I completely agree with you. So, Dr. Patel, what is an advice that you would give to someone who has just started prepping for the exam? And I will ask you for someone who is more of a recent graduate, because
Mhm.
a younger graduate like you, and
Uh-huh.
so who does have very strong theoretical experience and does have some clinical experience, but not possibly like someone who maybe has been practicing for 20 years and now wants to do the advanced standing. So, what's your advice for our viewers?
I would suggest that, you know what, while they are preparing for their exam, they just don't need to like sit like 24 hours at home and just get study. Instead of that, rather they would have like choose to work at least part-time, at least 2 to 3 days in any dental office as a dental assistant, or somebody's doing as a shadowing, whatever they prefer. But I would prefer, because in India and in US, they both work as different dentistry.
Hmm.
Even like all materials are different, all files, root canal RCT file system is different. So if you won't practice in any dental office as a dental assistant, or if you don't shadow anybody, then you would have not done anything in here, and you can like give your best choices in exams. That's what my suggestion is, because I have like experienced that really good, as I was working with Dr. Nick, Dr. Jim.
Nice.
So I can say that while you are practicing, while you're studying, is the best thing that you can, just as soon as possible you can get it.
Very
That's
nice.
my suggestion. Yeah.
That
Yeah.
is amazing advice. And then Dr. Jim, what is that advice that you would give to students? And since students using the decks are going to be everyone, new graduates, experienced dentists, um,
Right.
what would you tell them about the new decks that is going to help them?
Well, I think what the new decks will do is show them what they're going to be facing. In other words, when they come to it, they come to a question, they're not going to be surprised because they've seen this before. The format of it, like Dr. Patel said, we're not repeat questions, but you're gonna be prepared to answer it any way they ask it. And if you're you're coming over and you're very clinically oriented, but you haven't been in the classroom, then I wouldn't spend so much time on, I would spend maybe more time on the library for certain areas that you haven't had, the anatomy, the physiology, things like that. That's what I would do. And I think Dr. Patel is right, is to go into an office and shadow or be an assistant, because I can imagine that it is much different. And that takes it takes that scariness out of it. Okay, well, this is how it is in the US, and it just gives you that comfortability there. Um, but I would definitely recommend the digital dental notes, and start in areas that you're not as strong, that you don't feel you're strong. Like, go back to your didactic classes. That's where I would start. I really would. The anatomy, the physiology, biochem, micro, get that out of the way, and then go into like the oral pathology, the pharmacology. Not so much, the operative or prosthodontics. I mean, you should review that, because it may be different than it is in another country. But again, that's clinical. That's a lot of clinical stuff. So I would concentrate on the didactic stuff and then go to the clinical, and vice versa. If you're don't have the clinical experience, but you're freshly out of the didactic part, then do exact like the opposite, right? Start with the prosto, start with and then go back and then review your anatomy, physiology, biochem. That's how I would do it.
Perfect. So I think to all our viewers worldwide who are going to watch this video, from what Dr. Jim and Dr. Kesha had said, one most important thing is don't be scared. We all at some point have been in this boat, and we somehow all learn to sail, and so will you. Number two, start with topics that really scare you. And then wherever you feel you're overwhelmed, go to topics that you're great with. So that boosts your morale, that you know everything, And I think one thing which I always tell my viewers is do not compare yourself with anyone at all. All two applicants are never the same. You, in a class of advanced standing or DMD students, everyone is entirely different. Their experiences are different. Some have been dental assistant and then decided to go to dental school. Some have been dental hygienists and then decided to dental school. Some have been engineering students. They chose that, they don't like engineering anymore and they became dental students. Some have been amazing musicians who came to dental school because this is the only field which is, art and a science together, and it's the best merger. Coming to advanced standing students, there have been people who've been clinicians. There have been moms who've taken a sabbatical and are coming back. There have been fathers who've taken a sabbatical and are coming back. There are people who got married in the US and, they enjoyed their family life and now want to go back to clinical practice. There are young single people who want to come back. There are people who are young at heart want to come back. There are people who are in their 20s. There are people in their 30s, 40s, and 50s who are coming back. So please do not compare yourself with any applicant. That is my humble request to all of you. We all are unique in what we bring to the table. And I think that is what a school looks for when they are looking for that cohort in their advanced standing or their DMD students. So please do not get overwhelmed by anything that you see, or hear in your friend circle or social media, or, if someone puts their profile saying that this is my profile, this is my GPA, I took my inbde, this is my experience, and I got in 10 schools. I am very happy for them that they got into so many schools. And then there are some who just applied to one school and got in that school. And then some are who applied to the same school 2 times, but got accepted the 3rd time. So everyone is very, very different. All of us are very, very unique. And I think our uniqueness is what attracts a school to us. Because please remember, we are selecting a school and a school is selecting us. It is a 2-way street. It's never a 1-way street. Yes, it is very, I won't say it's the easiest thing to get in a medical or dental school, but it's not the most difficult thing also. Dr. Jim, do you agree with that? We both go to school here, and soon Dr. Patel is going to go to school here.
Yeah. 100%. You have to believe in yourself, and don't just believe in your dream and go for it. Don't listen to the, I call it, noise around you. Some people doubting you, or you can't do this, you can't do that. You can do anything you put your mind to.
You can do it. Yeah.
You can do it.
Perfect. So basically, one more thing I definitely would request our viewers is if you have any questions, either for Dr. Jim or Dr. Patel or me, please feel free to comment in the comment section below. I promise to answer all your questions, and so will Dr. Jim, because we are coming up with something really nice, and we will announce that very soon. But there is going to be something which is very, very helpful to all of you coming soon. And the reason I have been a little slow in the last few months in answering your comments is I have a good news. I am blessed with a son who's 9 months old now. So my priorities and my happiness is him. And now that he's 9 months old, I know he can sit for some time while I record a video and while I'm answering your questions. So please, please, please feel free to send as many questions as you have. Dr. Jim and I are actually going to do a live Facebook event and a live YouTube event where we will answer your questions live. And like always, those events are going to be free. We just will request you guys to basically register in advance so that we know if there is a special request that we have to make to either of the platforms to accommodate all of you. If you want to meet Dr. Jim at any events, he is there at the ASDA events. You will meet him at a lot of dental events. Are there any new events, Dr. Jim, that...
Well, I just got from the NLC in Chicago, and I'll be heading to Denver in February for the ASDA annual convention.
Okay, great, great. I'm going to put a date for those who are going to, who are either in the Denver area or who would like to meet Dr. Jim in person. And then that way you can have the date saved for you. If you have any questions specifically for Dr. Patel, please put them in the comment section. And Dr. Patel is going to be very busy right now because she has to apply for schools. But then definitely,
I would be happy to share my reviews and all answers.
Thank you, Dr. Patel. I appreciate it. And we will definitely put a discount code for all of you for Dr. Jim's dental notes for those who would like to get a subscription for that. And I think I would encourage everyone to use them and try them, because I feel that that's a one-place stop where you are not only getting a question answer type, so it's kind of mimicking what we are used to seeing on a screen of the boards. The other thing is you can always go back to the library and read that why is the answer this and not that. And if there is anything else that we can help you with, please feel free to drop us comments in the section below. Dr. Jim and I are going to be a little more active on our social media platforms. I more than him, because Dr. Jim has a full-time clinical practice to take care of. I have a full-time baby to take care of, but I promise to log in and check every day. And I want to thank Dr. Patel a lot for giving us her precious time and sharing her views with us and her amazing journey. Dr. Patel, we wish you all the best.
Thank you. Thank you. Even I would say thank you, both of you, that you give me a best platform that I can share my good reviews to everyone, so that, I can help if somebody needed it. Because I know that it's very tough journey to get into it. I know that. So I would be happy to share my experience, and once again I'm going to share that please just try once dental digital notes. It's really, really helpful to me. So yeah.
Thank you.
Jim, any words for our viewers?
No, for me, no.
All right, so I think we will conclude our video here, and I want to wish all of you all the best in your journey. Stay happy, stay healthy, stay strong, stay positive. And you know what? There's a role. Whatever you send out to the universe at some point of time definitely gives you that. So please stay positive, put all your heart and hard work in it. And you know what? For some reason, if that is not what, if you're asking and that's not what you get, remember one thing: there's someone out there, whether it's universe or whether it's God or any superpower that you believe in, sometimes what you deserve is a gazillion times more than what your heart desires. So on that note, I want to wish all of you all the best, and we will definitely get in touch with you soon. Take care. Bye.
Bye-bye.